The City of Wisconsin Rapids seeks to become a more family-friendly community, and that means providing access to farmers markets, providing breastfeeding services, providing great family recreational opportunities.
The WIC program is a behavior change program, and so it's important to have community partnerships to ensure the environment around us is conducive for healthy lifestyle changes.
Oftentimes, healthy community work, as it relates to the city, focuses on built infrastructure, but it also means supporting efforts like our farmers markets to make sure that we're reaching all of our population, so that those that may be at high risk or high need in terms of access to fresh fruits and vegetables, that those are in places in the community that they can easily access them or where they're already convening.
We partnered with our providers with a non-pharmaceutical prescription, and they have the option to choose a farmers market for healthier food options. They can choose the YMCA for physical activity, and then they can also choose the WIC program.
I saw a child yesterday who had a body mass index in the 99th percentile, so severe obesity as even a young child under the age of 10. And I ripped off the pad and I said, look, there's a farmer's market here in the community where you can try new foods and kind of as a family experiment with that, and with really great prices and eating locally.
The priority areas that we focused on go hand in hand with the work through the grant, with the farmers market, nutrition promotion, also making sure that there's healthy food access through grocery stores, and with the Smart Meal program in the restaurants. We have a nutritionist here at Wood County Health Department that helps restaurants identify healthy meal options that they currently have or ingredients that they currently use that could be put together to create a healthy meal option.
With breastfeeding, we found that partnering with the Chronic Disease Coalition and the Wood County Breastfeeding Coalition, we were able to bring various partners to the table and really get those key voices and leadership there to move some of those objectives forward.
We have worked with the health department to, number one, make referrals to their lactation consultants if that becomes available. Also trying to partner with different clinics to make them breastfeeding friendly. Prior to the grant work, we didn't have any prenatal breastfeeding education that the providers were giving to the pregnant women. And so when we implemented this work, we utilized co-effective materials, and now we're providing a consistent message through the WIC program, through our clinics, and then through also our nursing staff.
Here at Marshfield Medical Center, we are using the co-effective materials that were presented through the grant. We are using them prenatally before patients are seen at the birth center. So patients are receiving information starting at their very first appointment that provides information on benefits of breastfeeding, how to prepare.
This grant work has really helped us in Wood County address some of our chronic disease issues, and especially with our WIC program, we've been able to connect with others in the community, and we can sustain this work because of the partnerships that we've made and built it into our strategic planning and other areas that we want to focus on in the future, so that we can expand upon the work that we started here and continue to grow and make partnerships.